tech folks who were here yesterday for several hours setting up. And can you give me the signal for when I can start? Can I start now? Okay. So good morning and welcome to all our ethnic media colleagues who have joined in person for this first on-site news briefing since March 12th, 2020. And welcome especially also to the reporters from across California and the Bay Area who are joining us over Zoom. We're honored today to partner with the California Department of Aging on this event and to host it at Choice in Aging, an innovative adult care center located in Pleasant Hill in Contra Costa County, some 34 miles by my count, east of San Francisco. For over a year, the California Department of Aging has supported ethnic media services and our network of colleagues in the ethnic media sector through doing briefings, supporting fellowships, doing civic engagement projects by individual ethnic media, and supporting advertorials to raise awareness of the impact of the pandemic on older adults and people with disabilities, and above all, in the last year to promote vaccines and boosters as the key preventive measure to protect these groups. Today, the California Department of Aging asked us to focus on the role of vaccines and adult care centers, enabling older adults to break out of the isolation of the last 2 years and begin to rebuild a social life for themselves. If you had come here and gone through the main entrance and walked through a room full of people dancing to Motown, you would have felt the wonderful, intimate karma that this center exudes. At 11 o'clock, people will begin gardening. Some of the Afghan residents are knitting goods for their fellow countrymen in Afghanistan. It gives a sense of connection to community and a sense of purpose to the day. It's really very moving. Our speakers today include the head of the Department of Aging, Susan Demarois, who will lead us off. Dr. Sarah Levin, internist with the Contra Costa Regional Medical Center, and Debbie Toth, the director of this center, and also a woman who is known as a pioneer in the field of adult care centers. She also oversees the Mount Diablo Center. These speakers will update us on current infection, hospitalization, and mortality rates for older adults, which you can also find in your folders through a data sheet they prepared for today's briefing, and which we will send to all Zoom attendees. And just by way of example, as our colleague Connie Nakano points out, 71% of deaths due to COVID in California have been among people 65 years and older. That's one of the facts on the fact sheet. They will also highlight a worrisome trend, a slowing down in getting vaccination rates and boosters among this population. 1/3 of people over 60 in the United States, 15 million older adults, are not fully vaccinated or boosted, which the former director of the CDC, Tom Frieden, called an issue of life and death, with the resurgence possibly of BA2, the latest variant. Finally, they will describe how isolation has proven to be almost as dangerous as COVID itself. For older adults who now need to know through our media in this room and over Zoom how to access services like this adult care center to support their mental health. And the first step, of course, is getting vaccinated and boosted. We will have time for Q&As after each speaker. And if you are on Zoom, please enter questions in the chat, which we will get to as time allows. I will call on questions from both our on-site reporters and those in the chat. We ask speakers to speak slowly. As you notice, I'm speaking slower than I usually do because we're very happy to have translators and interpreters in American Sign Language, in Mandarin, and in Spanish. Following the presentations, we have a wonderful lunch, but more importantly, we are providing a tour of the facility, access through one-on-one interviews with speakers and some participants, and of course, the great pleasure of being on site is that we get to connect with one another. We'll be sending a video of the briefing along with live tweets by my colleague Sunita Sarabji and a who's who of our speakers to all attendees this afternoon. So now, with special thanks to the California Department of Aging for arranging this unique opportunity, and just a word to some of our very important in-language media here. After the briefing, we'll make a special effort to connect you to people in the facility who can give interviews in language. Okay, so now let us begin with Susan Desmarois, who is the director of the Center for Aging. Susan.
Good morning. Thank you so much, Sandy. And thank you to everyone who is gathered here this morning and who is joining us on Zoom. We so appreciate your interest in this topic and your efforts to help communicate to older adults, people with disabilities, and family caregivers the important information we'll be sharing with you today. I'm leaving my mask on, right?
Yeah.
Okay.
You can take it off if you want. We don't have participants in the room.
Okay. This may help with the audio. So again, good morning, and a very special thanks to the California Department of Aging team led by Connie Nakano for making this possible, and to my fellow panelists who I'm eager to hear from. Today, on behalf of the California Department of Aging, my first message is thank you. Thank you to everyone who has brought us to this day, who has led over the last 2 years, the heroes, our local heroes, our county heroes, our state and federal heroes, individuals in government, individuals who provide direct services like Choice in Aging here where we are gathered today, our board and care partners, nursing homes, assisted living and hospitals, our EMS providers, and our nonprofit and community-based organization partners who have carried all of us of all ages through this pandemic. So our thanks to all of our partners in our communities around California. Today, I wanted to share 3 very simple messages. The first message is there are services and supports available in every county in our state. So individuals of all ages and abilities can access information, assistance, and referrals locally in their own communities. And there's a very simple step to take. There is an 800 number, 1-800 510-2020. And that's where anyone can start at any time to be linked to the services and supports that they need. The second message, in addition to services being available statewide in all 58 counties, is our network of aging and disability partners will meet individuals where they are. We know today many Californians have been fully vaccinated and boosted, including some 50 and older who've received their second booster shot. And it's possible that those individuals are very eager to resume normal activities. And we will meet them where they are and connect them to services and supports in their community. Services like this, adult day healthcare or adult daycare, services like senior centers, congregate meals and shared meals and dining, senior nutrition. So we will work where an individual is. We understand too that there are individuals who may be reluctant right now. Maybe they're not yet fully vaccinated and boosted, or they have underlying health conditions that cause concern. We will work with individuals in those circumstances too, and help provide services and supports virtually if needed, link them to telephone and virtual supports, and help educate on what is available to them in their community that they can access. Services like the Friendship Line might be a possibility. And our efforts to close the digital divide, where we're working locally to provide technology, devices, access to broadband, and data plans so that individuals can access, can engage socially with technology. And the third message that I want to convey, in addition to services being available in all 58 counties, and that we will meet people where they are with their comfort level, is it's very important for anyone who is eligible for Medi-Cal in our state, that they, as the public health emergency concludes, we will be renewing Medi-Cal applications. So it's very important to communicate that anyone who is eligible for Medi-Cal, that's the Medicaid program in our state, that they update their contact information so that we have their current name, address, telephone, and email on record so that we can contact them to make sure that they stay current with Medi-Cal when the public health emergency concludes. We don't want anyone's service eligibility or benefits to be disrupted in any way. And that's the important first step, is to make sure that everyone is current with their contact information, because people may have moved during the pandemic or their circumstances may have changed. So we want to make sure that there's maximum continuity of care for all Medi-Cal beneficiaries in our state. We're also excited that in the coming months, individuals 50 and older who are undocumented will become eligible for Medi-Cal and will now have access to all of the services and supports that our state Medicaid program provides. So it's important that we have contact information on individuals. So I just wanted to recap the phone numbers that people can use to access information. The first was anyone in our state of any age can call 1-800-510-2020. And with that number, we can link you to information, assistance, referrals, insurance, counseling, caregiver supports, legal services, home modifications, falls prevention, nutrition, and direct referrals for housing or transportation. So that's a key number. The second, for family caregivers, and a caregiver could be somebody of any age providing care and support to a loved one. There is a statewide number for caregiver resource centers, and that number is 1-800-445-8106. And I also mentioned to you our Friendship Line. This was established at the beginning of the pandemic and is available 24/7. Anyone who wants to have a live, warm conversation for some emotional support can call 888-670-1360. And they can find support in language by calling the Friendship Line. So today we wanted you to know that services are available We will meet people where they are, and it's very important for anyone who's eligible for Medi-Cal that they stay current in that system so their services are not disrupted. And now I'm so happy to turn it over to Dr. Levin, who will update us on the current COVID numbers as she's tracking them. Thank you.
Dr. Sarah Levin, internist with Contra Costa Public Health.
Good morning. It's a pleasure to be here and an honor to sit next to these two women who at the state level and at the community level made our work as a county health department possible during this pandemic, which was a tremendous, and terrifying disaster of of emergency. And yet we managed to find some silver linings in how we were able to build a new infrastructure in the way that we work with our community and with our state and federal partners to try and mitigate and reduce the deaths and the suffering that occurred. And I'm so proud that as a public health department and as a healthcare system in this county, we were able to partner with organizations like Choice in Aging to do mobile clinics out to our 500 plus board and care homes in partnership with the federal pharmacy partnership program, which was really facilitated by our state partners. And I think it showed us all the possibility of what we can do in the face of a serious emergency and disaster that threatens lives when we collaborate together and we really pay attention and focus our resources and our efforts on those that are most marginalized and vulnerable in our communities. The data is constantly being updated on our dashboard. It's cchealth.org, cchealth.org. And there are data dashboards there that show the trends since the beginning of the pandemic in terms of the deaths and the deaths in long-term care facilities versus the deaths by age, and deaths by location of city in contrast. So you can look at all those, but I'll just give you the overview trend, which right now we are starting to see, we're bottoming out from the Omicron, but you can see all the peaks, the initial peak, the Delta peak, the Omicron peak. And what we saw in every single peak was that the age group that was obviously most disproportionately affected with serious illness and death was the older age group. So the 65 plus or even 50 plus, which is why they set that new second booster as the limit. And although proportionally, we saw the amount of deaths occurring among that age group in the congregate care facilities, which makes sense because those are people who are the sickest and are already underlying have other illnesses, as well as they're in proximity, right? It allows for the situation of spread. But what we saw in the community of our elders was that it was often in multi-generational families, essential workers, the young people who had to go out and work and then brought it home to their loved ones and their grandmothers and mothers and fathers. And I remember from the beginning when we were in we had one little office at the public health department, we were taking all the calls as they came in. I remember the friendship line. It was like one of the first resources that we were really able to give out, which was a great thing to set up. But we kept hearing those stories over and over again, which is the cases that we were getting, and this continued throughout, were amongst those older people were community dwelling elders, but they lived again with family members who had to continue working through the pandemic. That was the only source of income for the family. And so I think, we really want, and then, of course, we see that disproportionately represented as well amongst our communities of color and who are often are working in our long-term care facilities, in our hospitals, in our schools, in all the community areas that needed to keep functioning. So as we rolled out the vaccines and we did these booster clinics and mobile vaccine clinics and then booster clinics, we did see that we're not having as much of uptake amongst those people who are the most vulnerable. And partly that's because of, we can't expect them to show up in the middle of the day when they're working or be able to transport someone to some of our on-site places. And so we did develop mobile clinics with Choice in Aging, helping us to lead that effort for our booster clinics. But I want to say also, we do have for people that we would do those in facilities or in board and cares, but we also do have a resource for people who are homebound. So if you are someone who lives with your elderly parent or grandparent, or someone who cannot easily get out of the house, we do have a place on our website, cchealth.org, where you can register and have a nurse come out to the home from our public health department to do boosters in the home. So I just want to encourage anyone listening out there that they are available. We did neighborhood-based sort of door-to-door efforts with our initial vaccine efforts. We have not been able to maintain that as much with the boosters just because of the resources that are available to us. But luckily, with partnering with our community-based organizations like Choices in Aging and some of our faith-based partners, One Accord, we've been able to expand some of those services, and we are trying to continue to develop provide booster clinics at our at our senior centers and our faith-based organizations. And so you look for those in your community if you still haven't gotten boosted, and especially if you're eligible for a second booster. The last thing I just want to touch on, since I have the platform, is there are treatments now and they're free. And so even if you do end up with an infection of COVID-19, and the sooner you start them, they're antiviral treatments, the sooner it will minimize the amount of illness that you experience from COVID. So it's really, they're available, they're out there. We are not we were in a scarcity situation at the beginning of Omicron. We are not any longer. They have been distributed to pharmacies in the community. There are some limitations. There are some interactions with other drugs. So it becomes more complicated for people who have renal kidney disease or maybe on a lot of medications. But these are medications that we really want to get out to people. There are now test to treat pharmacies where you can present and get an antigen test. And if you're positive, get the prescription right there on site for the 5-day course of the antiviral treatments. So I really want to, the people who we're seeing continuing to get significant illness from COVID, again, are our elder populations and our people that have underlying health conditions. So if you're feeling symptoms, it is best to go to a place where you can do test to treat and not wait until you're 3-4 days into the illness and you are already getting so sick that you need to go to the hospital to be cared for. And there's good evidence that those treatments can make the difference between having a mild cold illness and ending up in the intensive care unit on a ventilator. So I just want people to know that, again, those treatments are out there, they're available, they're in the pharmacies. Those pharmacies are listed on our website, but they're also available through your primary care physician if you have one to access. And then we have a hotline again at our local health department, and we will figure out how to get a prescription if there is someone who's not able to access them through those channels. So, yep.
Question. So many of us are reporting for audiences who aren't based in Contra Costa County.
Yeah.
How representative is what Contra Costa County is doing for other counties? And perhaps Susan could answer that as well.
Sure.
Are we looking at you as a model of what we should be expecting in our own counties?
Yeah, I mean, I would acknowledge that it is this, these medications for the treatment medications came from the feds and then from the state to the local counties to set up. And so I do think in terms of that treatment model of test to treat, that is really coming at the statewide level. So I will let Susan talk to that. But when I looked on and when we meet with our Bay Area Health Officers Group, which includes all our local regional health officer counties, they are very much doing the same model where there's certain pharmacies that are designated test to treat. They're very similar protocols that we're using from the statewide level, but I don't know if you have more to add.
All that I would add, this is Susan DeMorris again, is Dr. Levin is representative of the 58 county public health departments that are the backbone and infrastructure of our state's COVID response. So I would say you're definitely a pioneer and a front runner, and the mobile clinic and things that were developed here in Contra Costa, they may have been first, but are now being replicated in other places. And as a state, we point people to My Turn, which is a great a universal access point for everyone, especially for anyone who needs a vaccine or booster in the home, or if they need free transportation to an appointment, they can go to My Turn.
Okay, terrific. Now we will turn the panel over to our host, Debbie Toth, the director of this center. Debbie.
Thank you. Thank you, everybody, for joining us today. I am delighted that we can actually do something in person and that we have an opportunity to highlight what the incredible impact of adult day healthcare services are for our aging population, for our adults with disabilities, and for anybody who wants to continue living in their home instead of an institution. This last 2 years was unbelievably difficult, particularly for our aging population. The fear of death was real. Every day in the newspapers we read, it's the first time in my lifetime that every day in the newspaper we were reading about older adults, because we rarely read about older adults because they are so often invisible in our society. And here we were in a situation where they were dying and where they were getting ill at extremely high and scary rates. And to add further damage, we were asking older adults to do what we told them all along never to do, which was to isolate. We always tell older adults, do not isolate. It will negatively impact your health. But in order to save lives, we told them they had to isolate. And now we are dealing with trying to reconcile with what happened, because we, in order to save lives, had to do something that was counter to what is productive for our aging population. We need to socialize. We're social creatures. We need to be able to have community, to come together, to share a language, a culture, a friendship. And vaccines and boosters are the only things that have made this possible for our aging population. So when vaccines became available, and I use the word available loosely because there were not a lot of vaccines available in the beginning. We had Dr. Levin, who is our local, personal Dr. Fauci in Contra Costa County, who was the voice for older adults at the county level. So Choice in Aging is a nonprofit organization, and I think we're pretty beloved, but we don't have a lot of clout per se in terms of who gets what. And Dr. Levin really was the voice that led with, we need to address those who are most at risk, most underserved, most marginalized first. And she ensured that everybody in skilled nursing facilities, residential care facilities for the elderly, low-income senior housing complexes, all of these places had the vaccine delivered to them in their homes, in their places of work. So the caregivers caring for people living in those places were able to get vaccinated. I can tell you at Choice in Aging, we have a Russian program, we have a Farsi program, we have a general program. And our Russian program, the participants were not very interested in the vaccine. They said, we'll be fine. It's no big deal. We'll be okay. We want to come back to the center. And we said, we want you back at the center. However, in order to come back at the center to be safe for everybody, you have to have a vaccine to return. And even though they didn't want to get vaccines, when they heard that that was the only way to come back, they all got vaccines. We had 100% uptake in vaccines among our adult day healthcare participants because this is their community. This is where they meet, it's where they eat, it's where they convene, it's where they exercise, it's where they get the health interventions from a nurse, from a physical therapist, from an occupational therapist, but it's all disguised as fun. Like we're just hanging out, we're congregating, we're with our friends, we're playing pool, we're playing bingo. By the way, ask an occupational therapist why bingo is important. You think it's just fun for an older adult to win prizes, but it's actually really good between hearing what they hear, thinking what they think, seeing it on the board and moving. There's a lot that goes on and there's a lot we understand about that. And really our goal in these adult day healthcare programs that are now finally recongregating and coming back together is that we can live longer, more meaningful lives when we can connect with each other, when we can get the health and social services that we need, and when we're doing it safely because we've had a vaccine, because we've had our booster. And here at Choice in Aging, this is the first time that I have been inside a Choice in Aging building with my mask off with other people in the room, and I'm having a little heart palpitations about it right now, but our participants are not in this room, to be clear. We are still going with safety over sorry. We are still wearing masks. And our tomorrow, we don't know what it looks like, but our today looks like participants coming back to adult day healthcare because we have vaccines, because we have boosters, and because we have families and staff who are also getting vaccines and getting boosters and doing what they need to do to ensure the greatest safety. It's balance, right? We have to make sure that we're providing the services and supports that folks need, but doing it in a very safe way, knowing that these are the folks who are most at risk of death and bad outcomes from this pandemic.
Thank you, Debbie. I think the stars of the briefing
Yes.
are now about
Yes.
to take center stage. And should we all put on our masks?
Please,
Okay.
please.
I'm going to let you introduce them,
Okay.
and I'm going to put on my mask.
Celia, you want to go first? So we are going to have live Russian translation. Though Celia can speak some English, I think it's probably more comfortable for her to express herself. Is this a better microphone? Oh, for her. I don't get two. Okay. So, and Marina, you will translate for us? Yeah? Okay. Oh, you want to do English? Okay. So she's okay. Yes. Your English is wonderful. So Celia, tell me why it was important for you to come back to the center.
Oh, I was glad. I was.
It's okay.
Can I talk Russian?
You
Okay.
absolutely can talk Russian.
okay.
Yes, yes.
Because, потому что дома одна, никого нет, я пожилой человек. А прихожу в центр, здесь жизнь, здесь люди, здесь общение, здесь чувствуешь, что ты совершенно на другой планете. Так хорошо.
Okay. When she stay
Okay.
home, when she stay home, lonely, isolated, and she feel very upset. When she comes center, this is different story. It's place full of life, and she feels she need people, and people need her, and she just happy to be around her friends.
Thank you, Celia. Oh,
Могу
come
еще
on.
добавить. Я еще хочу добавить, что это прекрасный, это самый лучший day-care для нашего возраста. Когда я прихожу сюда утром и вечером, когда я иду домой, я всем говорю God bless you.
Oh.
И все, весь персонал, замечательные люди, чудесное обращение к людям прекрасное.
You got all that, Marina?
Yeah.
Okay.
Okay, she said she's very happy to come here, and when she come here, she really enjoy her time, and she very grateful for all people who help her to make her life better.
Yeah. Oh.
And Celia, сколько вам лет, можно спросить?
94.
Wow. Yeah.
Скажите, как полностью вас зовут? Имя и фамилия скажите.
Я Циля, это имя, фамилия Танковер.
So we can write it
Celia
down for you and
Tankover.
spell it out,
Yeah.
okay? Yes, thank you, Celia. Thank you. All right, Gilbert. Gilbert, come on up.
Thank you.
Thank you. Yes. Yes. All right, Gilbert. Come on over. So this is my friend Gilbert, everybody. And Gilbert just got a new friend at home, a new pet.
Yeah.
And what's her name?
I have trouble remember her name and
Gorgeous.
since gorgeous. And I'm so glad to have the doggy as well to help me not get nervous and things and showing me different things that I can do, with a pet and not running out in the street, but being careful of others as well as myself.
Yeah, so she teaches you a little bit of responsibility too. I
Yeah,
love
yeah.
that.
Yes.
So Gilbert, it was hard for you when the pandemic came and you had to stay at home and you couldn't come to the center, right?
Oh, yeah.
Can you tell us what it's been like for you to come back?
It's been good to come back here and talk and learn new things that I had, some of them I had no attention of. What's this? What's that? And I came out to talk and to do different things also with my cancer. And I'm thankful to be here.
Yeah, and what do you like to play when you're here?
Well, I wanted to play baseball, but that,
But we don't have a baseball field here, so
No.
you've got something else in the room that you like to do every day, don't you?
I like to play with my Chihuahua dog
Yeah,
and let her run around and everything because I am a very nervous man, and I learned new things. What my counselors have told me, and to just beware, don't take a nickel when you can get $1.
That's right. That's
Yeah.
right. And I think you're being a little shy, but Gilbert is our resident pool shark. He likes to play pool and he's very good at billiards, right?
Yeah.
Yeah. Okay. Well, thank you so much for joining us today, Gilbert.
All right.
Thank you. All right, Bonnie. You ready? Yeah. Hi, Bonnie. You can keep coming. You won't run over my toes. You're glad to be here. So
Yes.
Bonnie, tell us what it was like when you learned that you could come back to the program.
I was devastated that I knew we couldn't come, but when I found out that I could come back to the center, I was very delightful because these people have been great and a lot of emotional support, and I love everybody.
And we love you.
Yeah,
We love
thank
you. And what do you do when you're here, Bonnie?
I color pictures. I do exercises with staff and different things like that.
Yeah. And when you go home at night after a day here, how do you feel?
Tired.
That's perfect.
Yeah.
And what would you tell the whole world about what this program is like for you?
I would tell people that if you have a disability and everything, you can come here and get a lot of support and rehabilitation and everything. It's just great.
Thank you.
You're welcome.
Perfect. All right, Rebecca. You're up next. Sadie, want to say something?
Yeah.
That's okay. We're doing musical chairs over here. Just give us just a moment. Actually, it's musical walkers, not musical chairs. Come on, Sadie, come say hi. This is Sadie. Marge is our volunteer horticultural therapist, booster clinic administrator, and fundraiser event photographer, and her dog Sadie, who is also a therapy dog. And they are regular fixtures here at Choice in Aging. Thank you. All right, Rebecca, come on up. All right, Rebecca, be nice to me, okay?
Okay, I'll think about it.
She'll think about it. All right. So Rebecca, talk to us a little bit about what that first year was like when you couldn't come to your program.
Oh my God. Still an attendant camp?
The first year when you couldn't come.
Oh, very boring.
Very
boring.
bored.
Nothing to do. I mean, I have a dog at home too, a therapy dog, but I can't talk to her. I mean,
Yeah. Yeah.
and I'm a very talkative person. I love to talk to people. And I was really bored because I
It was
just lost my mom that year and everything. My husband didn't want to leave by myself. He was afraid I might do something, do anything to myself.
Yeah.
But
It was rough. yeah.
Well, rough.
And then you found out
The
if you got a
second,
vaccine,
I could
you could come back. And what did you think?
I said, great, great. We all got vaccinated. I moved in the house. I guess the dog can't get vaccinated. But
That's up next, Dr. Levin, dog vaccines. Okay.
and
What do you do when you're here?
we play bingo, we play games. color, we do word search. or
Word search,
games.
yeah. What about pool?
I don't play.
You don't play pool, you're not. no.
Sometimes I might.
But no,
no.
you're not that big into it. Do you get your
No.
nails done?
I used to.
Oh, maybe you need to talk to Victoria about
Yeah,
that.
the stubby nails.
Yes, it's time for the nails,
Yeah.
yes. But what does this program mean to you?
The world.
The world,
And
thank
just
you.
everything is, I have all kinds of friends, and everybody's really nice. And I just feel really welcome here.
Yeah, and love, huh?
Yeah.
Yeah, thank you, Rebecca, thank you.
And I do speak Spanish, I'm bilingual.
Oh,
I'm learning Spanish right now, but I am bilingual.
oh.
So buenos días.
Buenos dias, I love it.
Yeah.
Thank you. Thank you, Rebecca. Thank you for coming. Thank you. Okay, the question is if I can talk about the intergenerational program. So prior to the pandemic, we were doing intergenerational programming. We have a Montessori preschool that is co-located with our adult day healthcare programs on the same campus. It's called Choice in Learning. We're very creative. Choice in Aging, Choice in Learning. So the students would come over and they would have intergenerational activities with our older adults. And that could be in our general program doing singing. That could be in our Russian program playing Rummikub. That could be in our Farsi program making jewelry and doing artwork. You do not need to share a language to engage in activities and build friendships. They would come into our Alzheimer's Daycare Resource Center. This is a day program specifically for people with mid to late stage Alzheimer's. And we found something magical. Montessori activities and dementia activities work beautifully together. There's a natural synergy in these programs together. And where in the Alzheimer's program, we may only do an activity for 15 minutes or a half an hour to keep everybody engaged. When the children were overdoing the activities, we could keep them engaged for a lot longer. And it's a mutually beneficial relationship. So the year after we began intergenerational programming, I went over to the preschool to bring balloons to the teachers to thank them for being with us for a year. And they asked the kids, do you know who this lady is, pointing at me? And they said, yeah, she works next door with our friends. So none of those children will ever grow up to be ageist or ableist because these are their friends. So it's a pretty incredible program.
Debbie, thank you. And we have a final speaker, but before we introduce her, we have Kim McCoy Wade, and we may lose her unless we get her on Zoom now. And Kim McCoy Wade is the Senior Director of Aging, People with Disabilities, and Alzheimer's in Governor Newsom's, in the governor's office, and was formerly director of the California Department of Aging. And we're so happy, Kim, that you can kind of share with us your main concerns and your main hopes for us as media in terms of messaging to our audiences about older adults as they emerge from the isolation of the last 2 years.
Thank you, Sandy, and thank you to all of you for allowing me just a moment to interrupt the true experts who we've been hearing from. I am Kim Wade, and I'm delighted to be with you to lift up something. You know, we've had to be so focused on vaccines and boosters to save lives, but I'm so glad today we are focusing on vaccines and boosters to bring us back together, to reconnect. Just as we've been talking about with children, the need to reopen schools for so many reasons and do so safely. what you are seeing here is what happens when we reopen our community centers. They have different names: Adult Day Health, like you're seeing here today, and Choice in Aging, where Medicaid can help pay the cost. Adult Day, senior centers, but they're all community centers where adults come together. And we're so thrilled that not just with that vaccine and that booster, but everything you heard about today: masking, distancing, testing, ventilation, treatment, all of those layers are allowing people to come back together. And just for 1 minute, I want to emphasize what you're hearing about why this is so important, why isolation matters. I think a lot about the 3 M's with older adults and people with disabilities. One is mood. You've heard all the joy that comes from being together, and the sadness and even depression that can happen when you are isolated at home. So it is so wonderful to hear about pool and bingo and singing. This is by far the most joyful call I'm part of today. The second M is the mobility. You heard the participant talk about being exhausted at the end of the day from moving and stretching and dancing. Many older adults have lost mobility during the pandemic, and getting moving again safely is so important. And the third M is that mental sharpness. We all want to stay sharp, whether it's through bingo or our puzzles, all of the things that help us stay well and have choices in aging, as Debbie so powerfully says. You see that happening right here at community centers and community centers all over the state. So thank you for what you're doing to open and serve California's diversity of older adults, all ages, all abilities, all languages, all ethnicities, all family status, all immigration status. And thank you, Director Damaris, for offering to help connect reporters with local centers where they can see more of the diversity and hear from older adults and families who are being served. But really, my message today to all of us, if it's one takeaway, is keep current. Keep vaxxed, keep boosted, keep current. Those of us who are 50 plus, make that plan today. Call your parents, call your grandparents, check on your neighbor, check on the person next to you at church. Do you have a plan to keep current? And either that My Turn website is always a go-to, including for transportation or coming to your home, or your local public health department. Dr. Sarah Levin in Contra Costa, but all over the state, local public health departments continue to be on the front lines of helping us all keep current. So make a plan to keep current, not just to save lives, but also so we can reconnect. All of us need it all across the ages, but perhaps no one more than our older adults and people with disabilities. So thank you all, and let me get off the stage again. Let's get back to hearing from people who are the best experts on this story. Thank you so much.
Thank you very much. So Debbie, if you would introduce our last speaker, and then we'll take some Q&A, and then at about 10 minutes after 12 or 12:15, we'll do a tour and invite you to also have lunch. But now for our,
Okay, so come on up, and then I'm going to give you this mic. So this is Parvi, one of our participants in our Farsi program, one of the kindest, sweetest, most lovely ladies. Good afternoon. So you'll translate. So Hanifa, what was it like for you when you couldn't come to the program?
مامان میگه وقتی که تو در خانه بودی اینجا نمی آمدی چی احساس داشتی؟
خیلی روحیم داشت خراب میشد. حبیب همینجا. چون ما عادت کرده بودیم که بیایم سنتر، وقتی که کرونا اومد درست من به موقع واکسنامو زدم، اما خب نمیتونستم بیام توی سنتر. الانم خوشبختانه 4 میرم زدم. خیلی خوشحالم از اینکه میام تو سنتر، دوستامو میبینم، از اینجا یا چیزی یاد میگیرم، پذیرایی میشم. ممنونم.
When I used to be at home, I was so isolated because I was sad and upset, and I was waiting to come back to the program. when I have all my vaccination, I had the 4 vaccine, then I was waiting to come and opening the center. When I was here, I'm really happy because first I want to see I see all my friends that they are coming here. And also I was happy because I'm not alone and that they are helping me with all that I needed, everything.
Thank you. So what does this program mean to you?
مامان وقتی که اینجا می پروگرام بر تو چی بهای ارزش یا چی فکر میکنی وقتی اینجا هستی در این پروگرام می
برام خیلی خوبه اومدن اینجا.
I'm really happy. It's really good for me to come here.
Thank you.
Yeah. Yeah, so you can explain to her that she just asked me a question, I'll
Mhm.
answer, but I will say thank you. Yes, thank you, Pari.
Thank
Thank you,
you.
thank you.
Thank you.
Thank you.
تشکر مامان میگه خیلی ممنون.
So each of our programs is unique and what we call person-centered. So when you create a program that is going to best benefit somebody, it incorporates what they want to see in it. And so as we built out our adult day healthcare programs and built the one for the Farsi program, and the women, by the way, do not allow men in their program. No offense, men, but they get to take off their scarves, they get to dance, they get to do things in a room when it's just women that they wouldn't get to do when there's men in the room. And one of the other empowering experiences that these women had was in going through therapy. So many of them have a primary diagnosis of post-traumatic stress disorder, having come in from living under the Taliban and having experienced atrocities none of us can begin to imagine. And in the course of the therapies that they get here, they get a lot of PTSD or post-traumatic stress disorder therapy. And in the therapy, one of the things that kept emerging over and over again was this feeling like, I am a burden. I'm a burden to my family. In many cases in the Afghani culture where the mom needs care, she lives with the son, but the daughter will come and provide the care. And so they felt like I'm a burden to all of my children. And so the therapists really focused in on what are the things that you are really, really good at. And these women are incredible crocheters, needle pointers, knitters. And so they started working on those things that they were really good at so that they could feel like they were doing something. And we located an orphanage in Afghanistan, and we were able to send their sweaters, their beanies, their booties over to the orphanage. And the orphanage took pictures of the children with the beanies, with the booties, with the sweaters. And the women got to see that they weren't just a burden, they were doing something to give back and that their life had meaning. And it was truly revolutionary for them. And I think for all of us, none of us want to feel like we are a burden. None of us want to feel like we don't contribute. And I think that creating these day programs that are wrapped around what each of us wants will allow all of us to age with dignity and out of institutions.
Thank you. Well, that was a wonderful set of presentations. Let's take 10 minutes and go for questions. And one question I have to start is just how many centers are there like this in California? Are there maybe 3 or 4 per county? And are they dependent on nonprofits starting them? How does it work?
Today, California has 271 community-based adult services centers like Choice in Aging. Not every county has one. Most counties do. And many counties have multiple. They're also commonly referred to as adult day healthcare is how they're licensed by the state of California.
And if we wanted to find out county we're covering or we're based in, how would we find these centers?
We invite you to visit our website, which is www.aging.ca.gov. So aging.ca.gov is the California Department of Aging, and you can find information there.
Terrific. Let me go now to our on-site reporters and ask you for your questions. Francis.
Go back to normal. And it's just now, especially for younger generations, they have a spring break. So they're all without masks and then going back to their family or visiting their parent. So what would be your advice in terms of how to protect them?
Dr. Levin.
Thank you, Francis, for that question. And it's a really great question. I think what a lot of families are really dealing with. And I think the current CDC recommendations that we're all in line with is that if everyone's fully up to date on their boosters in the household and it's a closed household, then you don't need to necessarily take those precautions. However, I would say when you think there may have been, when we're in a state of significant or substantial amount of cases, which we have been with the Omicron, and when people are getting exposures with travel or being outside of the community, then I think a lot of people are electing to do things like test with an antigen, which is a measure of somewhat if you are carrying the virus, what level is it at? Could you be infectious before? So for instance, a kid coming back from school or being outside of that closed environment, visiting their elder parents or their grandparents, that may be an option to test before there's interaction if they want to unmask. So I think, it's certainly whatever symptom, if they're having any symptoms, obviously should probably avoid contact. But, I think we've all learned a lot of a lot of it's common sense in this current environment. But the official, as long as everyone's up to date and without symptoms, then I think it's safe to unmask. But if you want extra precautions, then antigen testing for people who may have been exposed and may be symptomless.
Okay.
Yeah.
In the interest of time, I want to ask people to ask short questions and short answers.
Sorry.
And the adult day centers opened in California and this one also particularly?
So
Bit of
that-
a history. That's for you,
Yeah, so
Debbie.
I think this is a complicated question that I will try to answer shortly and simply. Once we were allowed to recongregate, once we no longer were mandated to shelter in place or stay at home or whatever the vernacular was at the time. Sorry, the pandemic has made my mind lose all the things, but we were allowed to reopen at that point if we had the ability to do so safely. We could distance, we could mask, we could ventilate. There were a whole bunch of pieces that we had to make sure were in place in order to do that. Some centers opened, some did not. We were fortunate to have incredible leadership. The woman, Kim, that you saw earlier was the director of the Department of Aging at the time and worked with the California Department of Health Services to ensure we could do something called temporary alternative services. This meant that we could bring food to people's homes. We could go on their porches and play guitar and sing happy birthday on their birthday. We could deliver Easter packages, all these different things. We could deliver services in their home. We could do it by Zoom from here, and we still do. So we could do a hybrid model which is what we're currently doing at Choice and Aging, where we have some people here. What you're seeing today is about 30% of what we served prior to the pandemic. But we're still serving some people by Zoom, by delivery, by exercise in parking lots, a whole variety of different things, telephone calls. So it's rolled out different. And it did that because the state, in its infinite wisdom and partnership with the organizations, recognized that we needed to respond to the need, recognizing that we lost over 25% of our workforce. So there's not a lot we could do. So it's been a combination of things. Choice and Aging opened our program in Antioch in May and this program here in June.
To officially open years, how long have you been in operation?
Oh, so this was the 16th licensed adult day healthcare facility in the state of California in 1980.
Okay.
We
The
were closed
pandemic.
for, yeah.
The pandemic. Next question, yes, Pilar.
Yes, I wanted to ask, thank you. If from the state level or local level, what would you say is the key thing that we need to try to help the seniors recover from the isolation during the pandemic? If you have the wish list, what would be the thing that you, in the state level and the local level, request?
All three of you give an answer very short.
All right. I know we're asked to be quick. That's not an easy one. There are many, many things. And you heard about re-engaging safely. So in small ways and large ways, I would put a special note on family caregivers. So while individuals have been isolated, family caregivers have carried an extraordinary burden in the home. Many could not have home care that they ordinarily would have, or they couldn't bring their loved one to a center like this. So I would put a special focus on family caregivers. And that's why I shared that 800 number, because they need support too.
Yeah, I don't think I have much more to add. You know, that I think what we heard from the participants here is being back with their friends, with the people, their social environment, stimulating their minds and their bodies and their nervous systems, and getting them back those moments of joy on a daily basis, and not living in fear and isolation is what all of us as human beings need to keep thriving. So that's the most
Debbie.
important.
Yeah, I want to capitalize on the word joy. So for caregivers, for older adults, for the children of grandparents, all of those people, we all experienced a darkness. And I think joy is the remedy. And how we achieve that joy is individual. So if I am afraid of this pandemic, even though I've been vaccinated and boosted, the answer for me is not going to be coming to an adult day program. It's going to be that I get to do it via Zoom. It really is, how do we bring joy to each individual, and you build around them what their experience of joy is.
Okay, there were questions over here, Vandana, June, and then we're gonna end at 1:15 so we can do the tour.
Yeah, this question is for Susan. You mentioned a lot of resources that we were not aware of right now, and these are actually vital for the community to know. What efforts is your department making in doing outreach about the resources that are available for all?
One effort is today, so thank you for carrying that information to your communities. The other is over the course of the pandemic, we developed postcards and we provided resources. We mailed them to households. We know that many older adults and family caregivers may not be tech savvy and looking at websites and the internet. So I think close to 4 million postcards were sent to individual households that provided a variety of resources: AARP, the Alzheimer's Association, area agencies on aging, Friendship Line, crisis lines. So we'll continue to do that and through the department's website. And we'd love to work with any of you to do more in-depth information about the full array of services that are available to the community at any time. We'd be happy to do that.
So a final question from June.
Good afternoon. We've been talking about caring for adults or elders, but my question would be geared towards our caregivers. So almost 70% of which are Filipinos from the community that I come from. What are the major concerns being aired to you by Filipino caregivers or caregivers in general, and particularly on challenges they face up to now?
I'm happy to start with the answer with that. The governor and the legislature last year invested nearly $1 billion in the direct care workforce. So individuals who work for in-home supportive services, who work in home care, who work in nursing homes, assisted living, boarding care, received stipends and training. And we're examining career ladders currently, compensation, looking at ways that individuals can move up the healthcare continuum to licensed vocational nurses, RNs, and the governor and legislature this year are also considering an additional $1.7 billion that will look at community health workers, many of whom come from diverse communities and serve diverse communities, social workers, and nurses. So we're looking at the full spectrum of the direct care workforce. And as you know, many are Filipino.
Hey, I forgot that Zoom ended at 12. I forgot to say goodbye to our Zoom media. I feel ridiculous, but this has been so engaging. It just completely, I lost track. So is it still on? Well, first of all, thank you so much to our Zoom audience. Thank you especially now to our on-site audience. Those who would like to do a tour, I will ask Debbie for instructions, but I think we got a window into the programs through the participants. So those of you who would also like to do one-on-one interviews with our speakers, now is the time. We have them for another 15 minutes, and then we also have lunch. So a final note, I want to give a personal shout out to a longtime friend and advocate of our media, and that's Connie Nakano. She was the inspiration for many projects to help us do a better job covering the issues that older adults need to know, as do the caregivers and families and friends of older adults. So Connie, thank you for today. Thank you for the year. So officially, the conference, the presentation is ended. My thanks to Jay for wonderful, and his colleague, Kenny. Thank you for setting up this, which would have been totally beyond our skill set. So thank you. Thank you to our speakers.